I chose to talk a little bit about the sort of share a moment where you see firsthand what it looks like where the healthcare system works well. And I'm going to go with a sort of personal example. I think a mistake that a lot of us who work more on the business or administrative side of healthcare often do is we don't talk enough and we don't ground ourselves enough in the patient stories that are at the center of a lot of what we do. And so about 3 years ago, one of my family members unfortunately got really ill. They had multiple bouts in and out of the hospital for years. They were sort of bound to their bed at home when they were able to be discharged into the home. And I was thinking a lot in preparation for this segment about what was it that made that experience go well and what made it really troubling. And I think the thing I was thinking a lot about was the part that was most valuable, the part that meant the most to us as a family, to my uncle as unfortunately a patient, were all the things that made healthcare deeply personal. And so the way the nurses helped support him with a variety of the things that he needed when he was actually in the hospital, the way we had home health aide supported him in the activities for daily living and actually helped with not just the clinical things, but also actually a variety of support on, not just taking pills, but like helping you actually go to the bathroom and helping you actually take the right level of food. And so what I wanted to highlight maybe for this session is I think it's always important for us to just center the personal side of what matters in healthcare. And in the work that we all do, on not just talking about innovation and, hey, look how great and fancy this new tool is, but highlighting how does that tool actually get us down to what matters most, which is the doctor-patient relationship, the nurse-patient relationship, and how do we actually make sure that we can all maintain the intimacy of what makes healthcare so personal.